Thank you, Secretary Becerra. We'll start our round of questioning. I'll take the prerogative to go first. Our communities continue to struggle with the opioid crisis. Just last year, nearly 108,000 Americans died from a drug overdose. That's a record high. Reversing this trend has only become harder because of the growing prevalence of fentanyl in our communities. Fentanyl can be 50 times stronger than heroin and 100 times stronger than morphine. And it is increasingly involved in the vast majority of accidental fatal overdoses. So how are HHS programs adapting to the new challenges of substance use and abuse that we're seeing?
Madam Chair, this budget, as you will take a look, invests some $11 billion, including some $10 billion in discretionary funding for programs that try to target opioids and overdose-related activities. It is a significant increase over previous years, and it complements the work that we've done to establish a new strategy when it comes to drug overdose and treatment, where we don't only try to prevent people from taking up a drug, but also beyond the treatment, we worry about harm reduction to make sure that we're preventing people from harming themselves before they finally can get the treatment they need. And then finally, we are trying to focus a great deal more of our time and resources to ensure that there is post-treatment services available in the community. So once you finish the treatment, you don't fall off the wagon, and we keep you as a productive member of society.
Drilling down a little bit more deeply, and I just want to reflect that just in the time that I've been in the United States Senate, I feel like I've seen the opioid epidemic, the substance use disorder crisis really change fundamentally, and especially, obviously, I just referenced fentanyl, but I'm also particularly concerned about the increase in overdose deaths among really young adults. Throughout the country, the average age of opioid overdose victims has been dropping, spurred by the abundance of fentanyl, and again, what I referred to as accidental fatal overdoses. So what is HHS doing specifically focused on our children and young adults to prevent young people from seeking out illicit or fake pills and make life-saving, what are you doing to make life-saving overdose reversal drugs available to under-resourced communities?
Madam Chair, we are doing the best we can right now to reach out with our states as partners to try to get to where kids are. The 988 program is a perfect example of how we're trying to reach children, young people today in ways that we hadn't before. And so it shouldn't surprise anyone that the most effective tool today to reach a young person who's experiencing a mental health crisis is not to give them a phone so they can call 988. It's to let them text or chat to us, because that's what we've seen a dramatic increase in, is the texts and chats that we're getting principally from young people. Then, of course, what we want to do is, to the degree possible, offer them peer support. We know that sometimes it's tough for young folks to talk to adults. We know that sometimes they're afraid to talk to adults, but to their peers, they seem to open up a great deal more. So whether it is providing the resources to actually know how to reach them, and then provide them with the most friendly way to discuss their concerns, we're going to do all we can to try to get to our young Americans.
Thank you. It was brilliance for the Federal Communications Commission to figure out that we needed to be able to text 988, not just call 988. And I was so pleased to learn they were doing that. I want to stick with 988 for a moment. Recent data from the CDC shows that teens who identify as lesbian, gay, bisexual, transgender, or questioning are experiencing high levels of mental health distress. In 2021, almost half of LGBTQ students reported seriously considering suicide, including more than half of transgender or non-binary youth. Nearly 1 in 4 LGBTQ youth attempted suicide, and nearly 3 in 4 reported persistent feelings of sadness or hopelessness. These are startling numbers, and we must redouble our efforts to support these children and young adults. I've been glad to work with you and the department in creating a pilot within the Suicide Prevention Lifeline, which is now 988, to provide particular services to LGBTQ youth. And so I'm asking, what kind of need are you seeing for crisis service among LGBTQ youth, and how has the specialized service pilot helped support this population?
Madam Chair, our budget actually calls for support, funding support for specialized services for LGBTQI plus communities. And so we are already working on that. We know that in many respects, the population within that community is far greater that is at risk of suicide. And so we are already targeting there, and we look forward to working with you to try to expand that scope.
Thank you.